We all have skills that are useful to ourselves and others. We know how to bake a cake, fold a fitted sheet, change a tire. While these skills are beneficial, there are some that can be life-changing. Today, I'm going to talk about the importance of CPR, how it differs in children and adults, and how to perform adult CPR. Cardiopulmonary respiration, better known as CPR, is a life-saving procedure performed when someone's heart stops beating or when their lungs aren't working. CPR gives you the chance to bring back someone from the brink of death. According to the American Heart Association, CPR acts as a manual heart for those who need it. It helps oxygenated blood flow to the brain and the vital organs until the EMS arrives. Majority of cardiac arrests happen outside the hospital, meaning a bystander has a better chance of saving a life before the EMS arrives if they're properly trained. While most people believe that CPR is the same, it's not exactly true. While the main purpose of CPR is the same for adult and children, it differs due to the small and fragile frames. According to Vive, the major differences are compressions versus breaths, depth and force, and when to call 911. While majority of these suggestions aren't as vital, but some of them are. For example, when to call 911. For an adult, you're supposed to call 911 immediately and then start CPR, while for children, you're supposed to perform 2 minutes of CPR and then call 911. These are in place to ensure better safety and proper execution of CPR. Now I will demonstrate how to perform CPR for adults following the Mayo Clinic instructions. First, you're going to assess the scene, making sure that it's safe for you to enter. Then you're going to check for responsiveness using the shout, tap, shout method, ensuring that there's no life-threatening bleeding and responsiveness. Can you pause it for a second? You're going to use the shout tap method to look for life-threatening bleeding and responsiveness. Hey, are you okay? Sir, are you okay? If there's no response, you're going to call 911 and tell them your location and details about the patient. Then you're going to start performing CPR. You're going to interlock your hands and place them in the center of the chest. You're going to be sure to push 2 inches deep at a steady rate of 100 and 120 beats per compression. And be sure to count out loud so you keep track. If someone arrives, they know what compression you're on. Once performing 100 to 120 compressions, you're going to begin breaths. You're going to tilt the head and pinch the chin. Take a breath and then completely seal your mouth over the patients. Be sure to have a second between each breath to properly execute the breaths. I'm not going to put my mouth on that. Sorry. Once done, you're going to check pulse to see if there's one. If not, you will continue compressions at a rate of 30 compressions versus 2 breaths. Today we learned about the importance of CPR, how it differs between children and adults, and how to perform adult CPR. So take this as your advice to go get CPR certified. Who knows, you can save that person who's getting ready to frost that cake, put away that folded sheet, or change that tire. Thank you.